I want to thank you again for coming here tonight. It's wonderful, and to the Forresters, thank you for opening up your beautiful home. Betty and I had 8 presidential receptions in our home during the election, the primary cycle. Almost 2,000 people came through, and I know how much work it takes to do a reception, and I'm grateful very much to you, Jeannie and Keith, for your hospitality, your warmth, and your friendship. So thank you very much, and I'll be happy to answer questions. Don't be bashful. Yes, sir.
Never shy to speak, Mark Dillon. As a teacher, as somebody who headed up the Department of Education in the state, and who, as somebody who clearly recognizes the coming hurricane of healthcare reform under the Affordable Health Care Act, I am very concerned, nobody in this room doesn't know that healthcare is crushing our public school system. It has become an ever-growing part of the budget, dangerously cutting into the education of our children. What do you see as potential solutions to that tsunami that is wreaking havoc in the schools?
Right. Now, when you talk about healthcare in the schools, you mean the healthcare for our teachers and that piece of the expenses that we've incurred? Yes. Okay. First of all, I'm glad you asked about the healthcare question. I work in healthcare. I represent Catholic Medical Center. I worked actually represent Franklin Regional Hospital in the affiliation or merger with Lakes Region General Hospital. And I've come to learn all too well how distorting the federal government's role in healthcare is already, let alone Obamacare. The greatest threat to New Hampshire and New Hampshire businesses is the implementation of the Affordable Care Act, that nationalized, which is what it is, healthcare program. So I'm here to tell you the very first thing I'll do as governor is to order the Attorney General to join the lawsuit with other states on Obamacare. And the decision of the Supreme Court in June isn't going to be the end of the day. It's just the beginning of the fight. And we should be there. We should have been the first state to bring suit against the federal government on these mandates and this what's going to become a one-size-fits-all approach in healthcare. It's going to drive up cost, lower quality. If the Attorney General says to me, I've been appointed by Governor Lynch, I'm not doing that, then I'll do it myself. I know how to bring a complaint, I know how to write one, and I'll bring the lawsuit myself. That first day one, on inauguration day, after putting my hand down and saying a few words, I'm going to go file that suit, and I'm going to have other lawyers helping me with it. It is critical. Now, to go further than that, we need to push back on the federal government when it comes to Medicaid rules and regulations and Medicare rules and regulations that, again, distort our marketplace. And we need to ask them to block grant these monies to New Hampshire. That's the direction we should be going in. In the meantime, we need to look to make New Hampshire more competitive from a health insurance perspective. We've driven out our health insurance carriers. It's very hard to get the kind of competition in the marketplace that will lower costs. And that is a critical piece of what we need to do to reform our state government. We continually mandate all these things on health insurers, which is why health insurers have left the state. It's not competitive. We need to open up our marketplace, allow our employers to pool their risk and work together and have a larger purchasing power in terms of health care. And then lastly, what about mechanisms that reward our citizens, teachers and others, professionals, for healthy habits? Give incentives for making decisions, life choices that actually helps them with their life, their health, and also reduces the cost of healthcare in the long run. And there's a way to do that, and there have to be a lot more education at the consumer level. By the way, we're not consumers in healthcare, right? Who goes and shops or prices things out? We need to change that. Well, some of you do, right?
We're self-insured.
Well, there you go. And we need to bring more market forces to bear. That doesn't mean making things difficult. It means to make things more robust and open for purposes of accessing healthcare. And so we have a lot of work to do. And so, anyways, I can go on a little bit longer than I should. I probably already have. Thank you for the question.
GrokTV.